Now, medical practitioners are calling on the federal government to urgently increase the health budget to at least 5%, with possible increment of up to 7.5% in a short period of time. That was the crux of discussions at a conference where medical experts deliberate on issues affecting healthcare system in the country. We have more in this report.
Nigeria is one of 4 countries with the lowest life expectancies in the world, after the Central African Republic, Lesotho and Chad, based on the latest data from the United Nations. In another twist, the latest World Health Organization survey ranks Nigeria's healthcare system as the 4th worst in the world. So, with these disturbing statistics in mind, these medical practitioners gather here to chart a new course in the area of health management system, focusing on the past, present, and the future.
We can deal with the health care system or education in isolation, but the bottom line is that our economy is being run into the ground, and we are not speaking, we are not conscious, we are not aware. Everyone is in a small corner. So long as you're earning your salary, your children are educated, you don't care.
Healthcare system at this time is relatively poor, poorer than where we should be. And it is sad because we haven't maintained the gains of the healthcare that we saw in the 60s and in the 70s.
Away from that, the rate at which Nigerian doctors leave the country for greener pastures form part of the discourse.
The future is rosy. Let us talk properly about how we will finance healthcare, make it a veritable investor's destination. Let people invest in it. It will yield good money.
Funds from the insurance, from the basic healthcare provision, from income generated from the primary health center, we pulled it into a treasury account, which means nobody can touch it, and there's visibility from the central. So we've taken care of corruption at the primary health level.
We've made it much easier for you to transit into residency. So if you know that, if a doctor, for instance, knows that he's going to get into training and become a specialist thereafter, he's more likely to stay. The third thing is wages. So among state governments, I think Lagos pays the highest.
One of the main areas that we need to improve is in training. We need to train more people. And not only training them, we need to retain them. One of the ways we retain them is by giving them professional and personal satisfaction in the country.
The discussion surrounding the healthcare system of the nation ended on an optimistic note, as practitioners here believe with the intervention so far by government, the sector will become one to reckon with. Theophilus Ilama, TVC News, Lagos.